Hey everyone, my name is Avi Desai and I am an upcoming senior in high school. Today, I am going to be talking about HPV.
So what is HPV? The human papillomavirus is a virus that can infect the body through means of physical contact, most commonly through sexual contact. It is the most common sexually transmitted disease in the United States, and there are more than 100 different types of the HPV. HPV is a different virus, however, than HIV and herpes. Some types can cause health problems such as genital warts, and others can cause diseases such as cancers. But there are vaccines that can help stop these health problems from happening. You can get HPV by having any type of sexual contact with someone who has the virus. It is most commonly spread through vaginal and anal sex, however. HPV can be passed even when an infected person has no signs or is asymptomatic. So who can get HPV? Well, anyone who is sexually active can get HPV, even if you've only had sex one time or with one person. You can also develop symptoms years after you've had sex with someone who is infected. This makes it extremely hard to know when you first become infected. In most cases, HPV goes away on its own and does not cause any problems. But when HPV does not go away, it can cause some major health problems, such as genital warts or cancer. So what risks does HPV have? Genital warts usually appear as a small bump or a group of bumps in the genital area. They can be large, small, raised, flat, or even shaped like a cauliflower. A healthcare provider can usually diagnose these warts by looking at the genital area. HPV can also cause different types of cancers, including cancer of the vagina, penis, or vulva. It can also cause cancer in the back of the throat. Cancer often takes years or decades to develop after a person gets HPV. The type of HPV that can cause genital warts are not the same types of HPV that can cause cancers. Now, there is no way to know which people have HPV will develop cancer or other health problems. People with weak immune systems like HIV and AIDS may be less able to fight HPV. They also may be more likely to develop health problems from HPV. So how can you test for HPV? There are different HPV tests that can be used to screen for different types of cancers. These tests, however, are only recommended for screening in women aged 30 or older. HPV tests are not recommended to screen men, adolescents, or women under the age of 30. Most people with HPV do not know they are infected and never develop symptoms or health problems from it. But some people find out they have HPV when they get genital warts. Women may find out they have HPV when they get an abnormal Pap test result. Others may only find out once they've developed a more serious problem. You can do several things to lower your chances of getting HPV. One of them is to get vaccinated. The HPV vaccine is super safe and very effective, and it can protect against diseases caused by HPV when given in the recommended age groups. The CDC recommends HPV vaccination at age 11 or 12, but if you can start at age 9, you should do it then. And for everyone through age 26 years, if not, they're already not vaccinated. Get screened for cervical cancer. Routine screening for women aged 21 to 65 years old can prevent cervical cancer. If you are sexually active and you're old enough to do that, use latex condoms the right way and make sure you are safely protected. And also, be in a mutually monogamous relationship and make sure the other person does not have HPV. Vaccination, however, is not recommended for everyone older than age 26. However, some adults aged 27 through 45 who are not already vaccinated may decide to get the HPV vaccine after speaking with their doctor about the risk of new HPV infections and the possible benefits that they might have over vaccination. The HPV vaccinations in this age range provide less benefit, as it's recommended you get it at a much younger age. Most sexually active adults have already been exposed to HPV, although not necessarily all the HPV types that are targeted. At any age, having a new sex partner is a very huge risk for getting a new HPV infection. People who have a partner are not likely to get a new HPV infection. Now remember, I am not a doctor or medical professional by any means. Please do not take my words as actual medical advice. I am simply a high schooler that wants to spread as much knowledge as possible. Thank you for watching.